Good afternoon. This is Dr. McDaniel back at GYN Corner. It's late today, Wednesday, June 19th, and I'm in transit today, so it's been rush all day. So I was not able to do my presentation continuation from yesterday this morning because I've been rushing since about 5:45 this morning, and I'm at the airport right now. I'm in transit. So tomorrow I will reveal my temporary new location tomorrow. As the information indicated, I will be continuing. I can't talk right now, sorry. I will be a lot of distractions over here. I will be continuing the discussion on breast milk when no baby. Yes, it can happen. Breast milk when no baby. Of course, breast milk when no baby is called galactorrhea, and it's not normal. The only normal circumstance for having breast milk when you don't have a baby in arms is if every blue moon someone continues to breastfeed their child just at night, so they don't breastfeed all day. The kid gets 2, 3, 4, 5 years old. I had a patient once who was still breastfeeding her 6-year-old daughter before bed as kind of like a ritual bedtime story, and then the breast. So of course that bedtime breast milk is probably about a half an ounce to 2 ounces, and it's not for the child, it's for the mother to keep that bond of her big baby. But that would be the only time it's normal, because the breast milk started with the pregnancy and she's been able to tease it along for the ensuing 6 years. But under normal circumstances, if you don't have a babe in arms or a small child that you're maybe breastfeeding for 6 months to a year, then it's not normal to have breast milk. You can have breast milk, though, under a variety of circumstances. So as I had stated yesterday, some of the what we would call risk factors for having galactorrhea will be medications. The most common medication are psychotropic drugs, antidepressants, anxiolytics, some of the antihypertensive, so blood pressure medications can cause it. Those are the big ones. So, some of the common ones, Zoloft, Xanax. I gave some examples yesterday. Once you go through medication and the patient does not have any medications that would put her at risk for having breast milk, then you want to go to medical history and an exam. So kidney disorder can cause potentially breast milk. Hypothyroidism, so low thyroid levels, can cause galactorrhea. And pituitary mass called a prolactinoma can cause galactorrhea. So you go through the history, you go through an exam. The evaluation should always include, top foremost is going to be a pregnancy test for an undiagnosed or an unknown pregnancy. Then it will be a hormone panel for pituitary brain hormone prolactin level. If that's elevated, that could indicate, it will indicate hyperactivity or increased activity secretion of the pituitary gland, and it could indicate a tumor of the pituitary gland called a prolactinoma. You'll also want to check to see if the kidney function is normal. And I forgot, under drugs, which I mentioned yesterday, is marijuana use. That can also cause it. So once you've gone through the exam, the history, you've done blood work for a full hormone panel and a physiologic panel, so chemistries, kidney function, electrolytes, all of that. If everything's perfect normal, the prolactin level is not elevated, then you'll want to make sure you've checked ovarian function, and if that's normal, then you'll speak with the patient about behavioral patterns, because if there isn't a medical indication, there isn't drug use that's causing it, or disease that's causing it, oftentimes it's overstimulation. So it's a nerve reflex arc that if you constantly or frequently are suckling the breast, fondling the breast, checking to see if there's any leakage from the breast, or massaging the breast, frequent stimulation of the nipple will cause galactorrhea, and it can be a milky, a clear, even potentially a blood-tinged or a greenish discharge that comes from the nipple. So if the patient says that either she is constantly examining or playing or fondling or tweaking her nipples, which some people do, or she has a significant other who is constantly or frequently often suckling on the breast, that will cause nipple discharge also. So the key for that is to ask them to stop checking the breast, stop manipulating the breast for a solid 3 months, and then see if the discharge has ceased. Lastly, it would be a breast sonogram and potentially a mammogram to see if there's a mass, a growth, a fluid collection, a nodule, a tumor that's pressing on a nerve in the breast that feeds the nipple, and that stimulation can also cause breast milk, nipple discharge, leakage of fluid from the breast. So that's been what I feel like is a quick overview of some of the risk factors, the evaluation, and the diagnosis of why someone is having galactorrhea or nipple discharge breast milk when they were remote from delivery. Now lastly, if one of the hormones is elevated, say the prolactin level is elevated, then that would be an indication to look for overactivity of the pituitary, a prolactinoma, so that would incur a head CT. And as I stated earlier, if the prolactin level is normal, then it's behavioral activity and looking directly at the breast to see if there's something in the breast itself. So that's the overview on galactorrhea. I hope that's been helpful. If anyone has questions or suggestions for topics to speak on, please send me a message through our Facebook or our YouTube page, GYN Corner. I'll be happy to answer them because this is all things health related for women. So this is Dr. McDaniel coming from Newark Airport, International Airport, and I'll be back tomorrow with the temporary new location for the presentation. Thank you very much for watching. Everyone have a great rest of the evening. Unfortunately, it's kind of rainy, overcast, foggy here in New Jersey, New York, tri-state area, but I hope it's sunnier, nicer weather wherever you're at. Thanks a lot, and I'll be back tomorrow. Bye. Okay, so got my temporary light. What are you doing? I can see lots of rummaging over there.
I'm looking for my credit card that I put in here in the little pouch. Because I just counted my cash money.
Where's the pouch?
Some dollars. You think they can treat us here for dinner?
Yes, if it's not long enough, I can
Yeah, because
add to it.
I know that the